Okay. I think what I'd like to cover is talk about vaccine and vaccination effectiveness. They're two related concepts, but it's important, and also some of the knowledge gaps. Because just last night, I attended the WHO conference on vaccination and the updates. Of course, even there, with all the experts in the world, there's still a lot of gaps in knowledge. And it's quite important because when we talk about vaccine efficacy, we're looking at some of the data from clinical trials. But in the real world situation, the effectiveness is something very different. Because when one talks about vaccine efficacy, you talk about preventing infections, susceptibility, preventing disease, because most of the clinical trials talk about preventing symptomatic disease and serious illness. But that's very different from preventing infection itself, because the vaccines are not as effective in preventing infection. Because when you do not prevent infection, individuals are infectious and they transmit the virus, even though they don't have symptoms, to other people. Right? So this is some of the problems that we have currently when people talk about the effectiveness of the vaccines. Very often they're not talking about the prevention against infection. Of course, there are also the variants, the characteristics that you have the so-called immune escape, as with the Delta variant, where vaccines are generally less effective. Then the other element of the effectiveness is the coverage, right? When you look at people talk about herd immunity, and figures that were bandied around early in the pandemic was 70%. Now we talk about 80%, 85%. So that very much depends on the number of susceptible people and how effective the vaccine is preventing transmission, right? So there are now updates in terms of looking at better data and then better models. And when you talk about a lot of these studies on herd immunity, look at general populations. They assume that the populations behave in the same way. So when they look at herd immunity, they look at the number of people susceptible, and then the number of people that are likely to come into contact with infectious people. So they assume the populations are homogeneous. But we know that populations are not homogeneous. When you look at some of the things that are happening, when we talk about vaccine coverage, 70, 80, 90%, but we talk about coverage in the so-called eligible populations. So when you have children and adolescents that are excluded from vaccination, they become the vulnerable, susceptible populations. So when you have 80%, 90% coverage in the general population, but no coverage in children and adolescents, you have then infections occurring in children, that then you have breakthrough infections in adults. And that's what you're seeing in many of the developing countries when they started vaccination in priority groups. And then the younger populations were not vaccinated. So in UK, when they started with the older populations, the infections then spread in the younger populations. And of course, then you also have then breakthrough infections in people that were infected. So currently, when we look at these so-called herd immunity, we talk about general populations. But of course, there's a lot of social and genetic heterogeneity. So that's in certain populations where there are a lot of migrant workers, and they're excluded from vaccination programs. So these become then the focus of infections, then they spread into the community, so you don't get that coverage. And the other problem with a lot of this concepts of herd immunity is that you control it, that you gradually able to control the numbers, but in the process, there are still going to be continuing infections. So that's what you're seeing in the States, in UK, in Singapore also. I think YY can talk about that, where you have over 80% coverage. So you have a lot of these issues that are not really adequately understood. And then obviously when the policymakers tell the public about this population coverage, and then the roadmap to relaxing some of these restrictions, these all have to be factored in terms of what you're trying to cover, and then when you have this continuing spread, what's going to happen. And the other element of vaccination effectiveness is the implementation, and I'll talk about this based on our experience here, but it's also is translated all over the world. we've been looking at the studies. We have studied ourselves in our population, looking at the barriers of people taking up vaccine, and then what are the facilitators, and then what are the strategies that one can use to improve the uptake. And this is what has been applied in Hong Kong. Obviously, people are concerned about severe side effects, lack of confidence in safety factors, the information or logistics, safety, insufficient data, and perceived low protection. Facilitators are if health professionals recommend vaccine. They also look at sources of information and health education by health professionals. So they play a very pivotal role in the uptake of vaccines. And the perceived importance in its assumption normal life, and of course the perceived benefits outweigh the risk of side effects. And when we looked at the implementation strategies developed from that, obviously one needs to provide reliable information, and importantly, engaging health professionals to recommend vaccinations for their patients. And of course, this is very, very important because many of the individuals do not just take the word of government or even messages in the public arena, but they seek advice from their own doctors or their own health professionals. Some of the influences of giving rewards. So in Hong Kong, we have been pushing a lot of this, that we even have a lottery. We have got businesses donating flats for people to have a lucky draw. Of course, that has some effect, but the impact is very minimal. And there are also a lot of social influence approaches. So when there are peer pressures, when there are pressures from employers, so these are things that will help push forward the vaccine. Of course, allowing selection of the vaccines, because we have got two vaccines here, the Pfizer and the CoronaVac, and permitting a choice enables people to encourage people to use it. Increase accessibility for vaccination. Increasingly, we are even stopping permitting people just to turn up to the centers for vaccination. Of course, also importantly, the emphasis on social responsibility. So these are implementation strategies that can help in terms of improving the uptake of vaccines. But it's quite important to have these implementation strategies at the outset. Many of these were done during the course of the vaccination, right? Obviously, the government thought that if we're going to provide the vaccines to everyone, when they started, we had a lot of centers open throughout the territory and very easily accessible. People could book and they could have a great choice, but the uptake was very slow because the main concern at that time was the anxiety about the safety of the vaccines. And when the government was trying to be very transparent, of course, we also, the other issue in Hong Kong was the pandemic started just after or in the midst of our social unrest. The unprecedented protests that we had in the streets in Hong Kong for over a year. And then obviously when the pandemic started, all that also petered out as well. But there was a great deal of mistrust. So although government provided all these, but there was this anxiety and concern about the information provided. And initially there were a lot of theories that these vaccines were there for another purpose, etc. So there's a lot of mistrust. But the important thing is that how do you actually provide this information to allay the anxieties of the public? So if you go backwards, for any vaccination strategy, one needs to understand the barriers and facilitators, and then plan your implementation strategy to address them. I think two of the biggest issues, one was, of course, the anxiety about the side effects. So government tried to be very open, and they were announcing deaths from people who had received the vaccine on a daily basis. So people got the impression that when you had the vaccine, you died from it, right? Because we had a lot of the population going for vaccination. Of course, normally on a daily basis, where people dying from cardiac, from strokes, from coronary artery disease. But then when these were announced as a sequelae to the vaccine, the impression was that these vaccines caused these serious side effects, and it created a lot of anxiety among the older population. That's why our uptake rate among the older populations is very low. And then also government was very, very careful to say that, if you have any chronic disease, you need to seek advice from your doctors. And of course, the doctors did not initially have very clear guidelines of who should be having the vaccination. So they were very, very cautious, and they were asking patients who had uncontrolled hypertension were asked to have coronary angiograms just to make sure they didn't have any complications. So those were a lot of the obstacles that started off because government didn't understand completely some of these barriers and perceptions that need to be dealt with. So the lesson that to be learned is that when you have the time to develop an implementation strategy for vaccination, one needs to understand this and then to have it right from the start. And I'll stop there.
Thank you. Thank you very much, EK. We'll come back with you with many questions.